So your child needs a bladder augmentation. This is Betty Ann Thibodeau, Pediatric Urology Nurse Practitioner at the Stollery Children's Hospital. Your child's surgery will be done under a general anesthetic, and your child will be in hospital for 7 to 10 days. Before discharge from hospital, you and your child will be shown how to care for the catheters and bladder at home. To learn more about what to expect on the day of your child's surgery, go to the Stollery website and search Your Child's Surgery. Immediately after surgery, your child will receive pain medication through their IV and by mouth. Your child may have pain in the belly and along the incision. Over time, the pain will become less and your child will be switched to oral pain medications before going home. Once at home, the mild pain may continue for a little while. Over-the-counter pain medications will help to relieve the pain. Speak to your pharmacist if you have any questions about your child's pain medications. The bowels normally contract and relax in waves to move food through the bowels. After surgery, the bowels usually stop working for a period of time, and it can take a few days for the bowels to wake up and start moving again. Some medicines may slow the bowels down as well. Your child may not have much appetite, may be unable to pass gas, have some nausea and vomiting, and the belly may get distended or bloated. If your child has a lot of vomiting, your child may need a tube inserted through the nose into the stomach to drain the stomach until the bowels start working again. Usually when the bowels begin to work again, your child will have a lot of crampy pain in the belly. Getting up and walking around will help the bowels move and relieve discomfort. A bladder augmentation is a surgical procedure in which a portion of small bowel is used to make the bladder bigger. The top of the bladder is opened and a piece of small bowel is sewn on top of the bladder as a patch to make the bladder bigger. Your child will have a large cut or incision in the abdomen below the belly button. Initially, the incision will be covered by steri-strips and a dressing, but the dressing will be removed before your child goes home. Your child will have a tube coming out of an incision in the lower abdomen, which is called a suprapubic tube, and a Foley catheter or a tube coming out of where they normally pee. These tubes will drain the urine from the bladder while the bladder is healing, and the urine will be collected in urinary drainage bags. These tubes will stay in place for at least 3 weeks. Daily care of these catheters will help prevent urinary tract infections, as well as prevent the tubes from getting plugged or pulled out by mistake. Your child may also have a tube with a bulb on the end called a Jackson-Pratt drain, or JP drain. This tube will drain any extra blood or fluid from the surgery site. The bowel normally produces mucus, which will continue after surgery. It is important to remove the mucus because it can cause urinary tract infections and bladder stones. To remove the mucus, the bladder needs to be irrigated. Initially after surgery, the bladder needs to be irrigated every day, but as the mucus production decreases over time, you will not need to irrigate the bladder as often. If the mucus production increases again, you'll need to increase the frequency of your irrigations. Before your child is discharged from hospital, you and your child will be shown how to care for and irrigate the bladder at home. A suprapubic catheter is a small flexible plastic tube which helps the urine drain from the bladder. The tube is put in the bladder during surgery through a small cut in the lower abdomen. The tube is held in place by a couple of stitches as well as taped to the abdomen. This tube will stay in place for at least 3 weeks while the bladder heals. A Foley catheter is a small flexible tube which is inserted into the bladder through the urethra or where your child normally pees. This tube also helps to drain the bladder while it heals. This tube will be taped in place to the leg or the abdomen with a securement device or medical grade tape. This tube will also stay in place for at least 3 weeks. A Jackson-Pratt drain or JP drain is a special tube with a bulb on the end which drains any extra blood or fluid inside the belly from the surgery site. The bulb is squeezed to provide a mild suction which pulls the fluid into the bulb. The bulb is usually emptied a couple times a day. This tube is inserted during surgery and is usually removed before your child goes home. The Foley and suprapubic catheters will be connected to large urinary drainage bags or bedside bags. These large urinary drainage bags can hold up to 2,500 ml of urine. These bags can be hung on the side of the bed or on a chair. These large bags should be used at night, anytime your child will be staying home, or when your child is lying or sitting for long periods of time. A leg bag or a small urinary drainage bag can be used for trips outside the house or during the day when your child is up and moving around. These bags are smaller and only hold about 570 ml. As a result, these drainage bags must be emptied more often. A leg bag can be strapped to the leg and hidden under your child's clothes. To prevent infections, it's important to always wash your hands with soap and water before and after any catheter care, before and after any skin care, before and after irrigating catheters, as well as before and after you change or empty the urinary drainage bags. Your child can shower or bath. You can hang the catheter bags outside the shower to keep them dry while your child showers or baths. You can wash around the incision with soap and water and then pat the area dry. Do not use any lotions or powders on the skin around the incision. Check the incision daily for any signs of infection. It's normal to have a small amount of redness around the suprapubic catheter from the tube rubbing against the skin. The incision and areas around the tubes can be left open to the air. Gently clean the area around the catheters with soap and water every day. Gently remove any crusted areas around the tubes. Clean approximately 10 centimeters down the catheter, moving away from the skin or the insertion site of the catheter. Rinse the area around the catheter and the catheter with warm, clean water, and then pat the area dry. Do not apply powders or lotions to the area. Apply antibiotic ointment around the tubes daily with a cotton swab. If there's urine leaking around the urinary catheters, you can cover the catheter insertion sites with a gauze bandage. You can cut a slit or a Y in the gauze so that the gauze fits around the catheter better. Then secure the gauze with medical grade tape. Change the bandage every day or when wet. Do not unhook the catheters from the drainage bags unless you're changing the bags or irrigating the bladder. Always make sure the catheters are draining all the time and that the tubes do not get twisted, kinked, or plugged with mucus. Irrigate the catheters if the catheters are not draining. Do not tug or pull on the catheters and always empty the drainage bags when they're half full. Keep the drainage bags clean, and the drainage bags should always be positioned lower than the bladder so that they drain properly. Keep the suprapubic tube taped to the stomach and the Foley catheter taped to the leg or abdomen with a catheter securement device or medical grade tape to prevent the catheters from getting accidentally pulled out. It is important to keep the bladder empty for at least 3 weeks after surgery to allow the bladder to heal. Ensure that the catheters are draining all the time to prevent the bladder from getting overstretched and rupturing. The bowel that is placed as a patch on top of the bladder makes a lot of mucus, which can build up in the bladder. The mucus in the bladder can cause stones or urinary tract infections. It is important to flush or irrigate the mucus from the bladder by flushing fluid in and out of the bladder. Irrigating the bladder regularly will also prevent the mucus from plugging the catheters. If your child has sudden pain or the urine stops draining, make sure the catheters are not plugged by irrigating them. Before your child goes home from the hospital, you will be taught how to irrigate the bladder. Before starting the bladder irrigations, empty the urinary drainage bags, wash your hands, and gather your supplies. You will need warm water. If using well water, boil first and allow to cool before using. You may use bottled or distilled water as well. You will also need antiseptic swabs to clean the catheter connections, a container to collect the fluid you withdraw from the bladder, a 60 ml catheter tip syringe, and a clean towel or washcloth to place under the catheter connections to collect any drips or leakage when you disconnect the catheter from the drainage bag. Your child may lie in bed, sit, or stand when you irrigate the bladder. You may find that one of these positions seems to work better than one of the other positions when irrigating your child's bladder. To irrigate the bladder, fill a 60 ml syringe with warm water. When you initially start the irrigations, you will use 30 ml, but as the bladder capacity increases, you can increase the volume to 60 ml. Place a clean towel or washcloth under the connection sites between the catheter and urinary drainage bag to collect any spills or leaks. Clean the connection site between the catheter and urinary drainage bag with an antiseptic swab. Carefully disconnect the catheter from the drainage bag. Insert the water-filled syringe into the end of the catheter. Gently clamp the opposite catheter tubing while you're irrigating the catheter, or the fluid will run out the opposite catheter. Gently push the water through the catheter into the bladder. Without removing the syringe, gently pull back on the syringe to remove the fluid from the bladder. You should drain the fluid you instilled in the bladder, as well as any urine or mucus which was in the bladder. Continue withdrawing the fluid until you cannot pull back any more fluid. If you do not get all the fluid back you instilled, do not force it, as the catheter may be up against the wall of the bladder. Disconnect the syringe from the catheter and discard the fluid you removed from the bladder. Do not put this fluid back in the bladder. Repeat the irrigations until the fluid you drained from the bladder comes back clear and there is no more mucus being pulled into the syringe. Reconnect the catheter to the drainage bag when you're finished. Repeat the process with the other catheter. Always keep the drainage bag below the level of your child's bladder. As the catheter is drained by gravity, this allows the catheter to drain and prevents urine from flowing back into the bladder. Check often to ensure the catheter is draining and the urine is flowing into the drainage bag. Always empty the drainage bag when it's half full, as it will prevent the drainage bag from overflowing and the urine from backing up. To empty the large urinary drainage bag, remove the drain spout from the sleeve at the bottom of the bag. Open the clamp on the drain spout and drain the urine from the bag into the toilet or container. After draining the bag, close the clamp and insert the drain spout back into the sleeve at the bottom of the collection bag. Always wash your hands before and after emptying the drainage bags. When changing the urinary drainage bag, wash your hands and gather your supplies. You will need a new urinary drainage bag, whether it's a large bag or a leg bag. Clean towels or washcloths to place under the connection site to collect any leaks or drips, as well as under the new urinary drainage bag, as well as antiseptic swabs. Empty the drainage bag and wash your hands again. Place the towel or washcloth under the connection site from the catheter, as well as under the new drainage bag. Clean the connection site between the catheter and the old drainage bag with an antiseptic swab. Remove the old drainage bag. Before attaching the new bag to the catheter, remove the cap from the tubing and clean the tip of the tubing. Attach the new urinary drainage bag to the catheter and place the cap back on the tubing of the old drainage bag. Always keep the caps in a safe place when not being used. Check the drainage bags every day for any damage. You should change the drainage bag every 7 days or sooner if the drainage bag is leaky, damaged, or discolored. Discard the old or damaged urinary drainage bag. Some important points to remember. Always wash your hands with soap and water before and after you do anything with the catheters or drainage bags, as well as when you perform any skincare. Always clean all connections with antiseptic wipes before disconnecting or reconnecting the urinary drainage bags. Make sure there's no kinks or twists in the tubing that would stop the flow of urine from the bladder. Irrigate the catheters if the catheters are not draining. If your child is very active, tape the connection between the catheter and drainage bag to prevent the tubing from coming apart. If your child has sudden pain or the urine stops draining, make sure the catheters are not plugged by irrigating them. Sometimes your child may have some mild discomfort from the incision or tube sites. Use over-the-counter pain medications as directed. If you have questions about the pain medications, call your pharmacist. If the pain medication is not working and the pain is getting worse, call your doctor. Your child may have some minor skin irritation or redness around the tubes. This is perfectly normal. If the redness around the tubes is getting worse, hot to touch and spreading out from the tube, call your doctor. It's not uncommon to have some small urine leakage around the bladder catheters. Sometimes your child may also have some red, beefy looking tissue around the catheters. This can be treated in clinic if it becomes bothersome. These are pictures of minor skin irritation that you may see around the tubes, from the normal redness around the tube to granulation tissue. Granulation tissue is that red, beefy tissue that bulges out from around the tube. This can be dealt with in the clinic if it becomes bothersome. Call your doctor or Betty Ann or go to your nearest emergency department if the catheters are not draining even after you have irrigated them, one of the catheters has fallen out, there are signs of a urinary tract infection, wound infection, or infection around the catheter sites, or you're having difficulty managing your child's care at home. Call if your child has any signs of a urinary tract infection or infection around the incision or catheter sites. Signs of a wound infection or catheter site might be irritated, swollen, or red, tender skin, pus from the incision or catheter site, the incision is opening up, increased pain around the site, a fever, or a general feeling of unwellness. Signs of a urinary tract infection may include foul-smelling, cloudy urine, increased mucus production, blood in the urine, fever, nausea and or vomiting, a general feeling of unwellness, or flank pain felt below the rib cage and above the waist on one side or both sides of the back. If you have questions, you can call your doctor or you can contact Betty Ann, the Stollery Pediatric Urology Nurse Practitioner, at 780-407-7010 Monday to Friday during the day. You will need some supplies to care for your child at home after surgery. You can either purchase the supplies from a healthcare store, pharmacy, or online. You may need to go to more than one store to purchase the supplies. For your convenience, you may purchase a care-at-home kit from the hospital. This kit will contain the supplies you require for your child for the first few weeks at home. This package must be purchased before your child is discharged from hospital. Please let your nurse know if you require a care at home kit. This is a list of supplies that your child will need at home after surgery. The suprapubic and Foley catheters are usually removed in clinic approximately 3 weeks after surgery. You will need to book a follow-up appointment in the clinic for the catheter removal. If you do not have an appointment booked when your child is discharged from hospital, call 780-407-1980 to book a follow-up appointment for approximately 3 weeks after your child's surgery. This video is made to help you care for your child at home and made possible with funding from the Stollery Children's Hospital Foundation.